actually for breast cancer, and what we're learning about breast cancer as a side note is it's a very heterogeneous disease. So we used to think of it as one disease, everyone gets the same chemotherapy, is really quite wrong. And so now a lot of the research is into subdefining different types of breast cancer. So there's one subtype that's present in about 20% of women, which is called HER2 new positive breast cancer. It's a certain target or marker in the breast cancer cells. And we actually have a treatment which is an antibody against the HER2 new called trastuzumab or Herceptin. So that's kind of a classic example of a non-chemotherapy targeted therapy. Probably one of the biggest, the sort of the grand slam for us has been in a relatively uncommon disease called chronic myelogenous leukemia, or CML. It's a blood disease. It's a type of leukemia that really was universally fatal. The only treatment was, historically, even when I started my training, was either a bone marrow transplant or eventually people would succumb. About, I'm trying to think now, 15, 20 years ago, people came up with, believe it or not, a pill, which is not chemotherapy. It's a targeted therapy that affects the chromosomal or the DNA changes that lead to leukemia. And now with this pill, we're always hesitant to use the term cure, but we basically, without chemotherapy, we're seeing people live 20, 30 years by taking this one pill for this CML, which is a targeted therapy, rather than the most aggressive types of chemotherapy. There's in lymphoma, there's a targeted therapy that looks at there's a certain protein on some of the lymphoma cells. There's something called rituximab which was one of the first monoclonal antibodies that we add to chemotherapy but fights the cancer. So these are a few examples of these sort of the holy grail for us in terms of these non-chemotherapy treatments that work beautifully and aren't as toxic as chemotherapy. So I'm thinking over the next 20 years, we're going to be giving probably less chemotherapy and more of these so-called targeted therapies.